I'm Bobby Connor for South Carolina Public Radio with Health Focus here at the Medical University of South Carolina studio in Charleston. Migraine is one of the major causes of vertigo. To talk about migraine and dizziness is Dr. Habib Rizk, Assistant Professor of Otology and Neurotology and Director of the Vestibular Program at MUSC. Dr. Rizk, how many people experience dizziness or vertigo that's really due to migraine?
In an otology clinic, where we see a lot of the dizzy patients, it's estimated that about 16% of patients present with migraines.
Let's talk about the symptoms of migraine-related dizziness.
So a patient for whom I give a diagnosis of migrainous dizziness or vestibular migraine, there are usually two categories of vestibular migraines, the definite and the probable. A patient with a definite vestibular migraine has at least 5 episodes of spinning vertigo lasting between 10 minutes and 24 hours, associated with headaches that can precede, come along, or follow the spinning episode. In some people, we don't have a clear history of headaches with the spinning, but they have what we call migraine equivalents. And migraine equivalents are visual auras, light sensitivity, and motion sickness.
And to diagnose this kind of dizziness with migraine, are you primarily getting a good history from the patient, or are there tests to determine this?
It's the perfect clinical diagnosis. You rely on what the patient tells you and what your clinical exam gives you.
And Dr. Rizk, what is the cause of this vestibular migraine that we're speaking of?
The inner ear has a lot of ion channels and electrolytes, and migraine activity, when it happens in the brain along the pain centers, causes headaches. And when it happens in the inner ear that has a rich collection of nerves, can cause these electrolytes to be altered and cause some of the symptoms the patients experience.
Now, are there common triggers or things that patients might be doing in their day-to-day routine?
The most common triggers are the same as for migraine headaches. One of them is barometric pressure. A lot of patients, when there's bad weather, they sense that a headache is coming on or they are getting dizzier. And that's also associated with allergies. Stress is a major trigger, and lack of activity.
And how about dehydration?
Dehydration is a major trigger for migraines, but at the same time, it's a trigger for Meniere's disease, which is an inner ear problem. And recently we found out that Meniere's disease and vestibular migraine are more connected than one would think.
Let's talk about treatment briefly. What is a typical treatment for people with this type of vestibular migraine?
Depending on the frequency of the attacks they are having, I discuss with the patients either conservative treatment or pharmacological treatment. If they have less than 4 episodes a month, we tell them to hold a diary, to keep track of their symptoms, and to keep track of dietary triggers, which is one of the triggers we can actually act on ourselves by changing our diet. If they have more than 4 episodes a month, then we suggest starting medication that can range from antidepressants that are used for headaches to seizure medications that are used for headaches and migraines to blood pressure medication that we sometimes use for headaches.
Dr. Rizk, thank you for providing this information about migraine and dizziness.
Thank you, Bobby.
From the Medical University of South Carolina studio in Charleston, I'm Bobby Connor for South Carolina Public Radio.